All. This is Mubin Sayed. I am in the KoolBeens Cafe Live, and let's have a discussion. So why not we do this? Let's answer some of the questions that were in the previous talk, and then we'll do some drawings as well. And in the meantime, we'll keep talking as well. So just a quick second. There is a call. I'm just going to mute you for just one quick second. Sorry, so my son was calling. Matthew, this is a good idea that I should have an outro prior to ending the stream. It will. I do not know if I can on the live. I can actually play an Outro. That's a good idea. I'll explore that over this weekend. Okay, so there is a question here. There was a question. Yes. So here is a question. Lonnie Fellerson says, "Hello all, I liked the previous lecture and I have questions that I should write down as the lecture proceeds. For example, Q. How might pre-existing autoimmune issues affect this process?" The only possible difference, again, the study itself did not talk about these things, so I'm responding from my knowledge, and this may be wrong. If somebody has autoimmune illness and there is a heightened inflammatory state in the body, then any other inflammatory state would only become heightened as well. And unfortunately, with the inflammation created by some of the vaccines, it is happening that people, and again, not all, but those who become injured, their previous inflammatory states or their allergies or previous areas where they had wounds, they start hurting once again as well, which means that there is an inflammatory state that is increased. So that is possible. So AFTF says, could the other vaccine platforms and or infection cause the type 3 response you spoke about? Yes. So type 3 is a normal physiological response as well. And what happens is, let me share my screen and maybe search it for you. Of course, I have on the YouTube, I have my videos as well about type 1, 2, 3, and 4 hypersensitivity reactions. But here, if I go to, let's say here, and I say type 3 hypersensitivity, then you would see here, in type 3 hypersensitivity reaction, an abnormal immune response is mediated by the formation of antigen antibody aggregates called immune complexes. They can precipitate in various tissues such as skin, joints, vessels, or glomeruli and trigger the classical complement pathway, which in turn would cause the damage. The most common disease involving a type 3 hypersensitivity reaction are serum sickness, post-streptococcal glomerulonephritis, systemic lupus erythematosus, farmer's lung hypersensitivity pneumonitis, and rheumatoid arthritis. And here, look at this. Etiology: serum sickness is caused by drugs containing a protein moiety part of other species, such as antivenins, vaccines, antitoxins, streptokinases. So, and type 3, I said it's a physiological function. It's the formation of antibody antigen complexes is physiological. Settling down on the tissue and creating local inflammation is not physiological. Normally, these complexes are trapped or eaten up by macrophages, especially in the spleen, and that is how they're cleared out. But sometimes they're not cleared out, or sometimes they're just in large quantities and they just start settling on various things. Jim says, as long as my non-Hodgkin's follicular lymphoma stage 4 is in remission, am I okay? Yes. Yes. And of course, please talk with your doctor as well. I can't give a medical advice. I wish to answer the personal questions so I can help, but at the same time, it's kind of, I think you all know. Meanwhile, in America says, do the S1 proteins go away at some point? I can't remember if we discussed that. Also, what's the treatment mechanism if S1 does in fact hang out in monocytes? So remember that there are many possible protocols, including I have led a protocol as well that is on FLCCC side, the I Recover. So the way to manage this situation generally is the following. S1 is present, or spike protein is present, or antigen, some antigen is present. That antigen is causing immune cells to be active. Immune cells in turn are causing inflammatory molecules to be released that is causing more inflammation. I'm speaking in very high level terms. So one way to calm down the system is to reduce the molecules that are being produced. So reduce their production. And then what happens is all the cells that were fighting, and once you take the molecules away, the inflammatory interleukins and cytokines, chemokines, if you take them away, then new cells do not arrive in that place, and the current cells that are there fighting, they would just say, all right, fine, I understand you don't want me to fight anymore. I will become reset and I would not do more fight. Some cells would actually be killed away. They'll be cleared out by killing and removing by phagocytes. So that is one way. Another way is to let that fight happen, but do not let more cells come in that area. So the chemokines function is to attract more cells in that area, more immune cells in that area, so that they can come and fight. And so if you suppress the chemokines, the RANTES and those kind of molecules, then new cells will not arrive. Old cells will get consumed and burnt out. New cells will not be there. And you would also then once again reduce inflammation. Then there are ways that, for example, intermittent fasting, which in some mechanisms, what happens is that these cells, when they do not have enough energy, they start going in a resting state and they die out, and they are then phagocytosed and cleared out. Then you can actually send active drugs that can go and start binding with these cells and stop their interactions with each other. These would be very strong drugs, and especially they're used as drugs for cancers, for example. Then you could send even stronger drugs that would just go and kill the immune cells or dividing cells, or stop the dividing cells from dividing, which would mean not more blood cells, not more skin cells, not more GIT cells, and so on. So there are many ways. But if I step back for a second, our body has a normal mechanism as well, where we clear out the antigen by making either directly eating up the antigen by phagocytes, or by complexing them with the antibodies and then eating them, the complexes, or by complexing them with the complement system and then eating them. And then the inflammation itself comes to a halt as well, because whenever we start the inflammation, we also start the mechanism to stop the inflammation. So we trigger the regulatory cells as well. The only thing is, regulatory cells would become more active a few days after the war. So you let the war happen for a few days, inflammation occur for a few days, and then the regulatory cell would start calming down the whole thing. So if we go back to your question, meanwhile in America, do the S1 proteins go away at some point? Ideally, yes. In normal, healthy individuals, or in those folks who did not develop a response or long-term injury or continuous injury, in them, this has gone away and the inflammation has settled down. But in some people, it doesn't go away, or maybe it is continuously produced. And then there is the continuous inflammation, which then turns into long haul, long COVID like symptoms. Nipa says, I have started doing intermittent fasting for some months, 16 hours, feel good. Awesome. And I wanted to, before I go into more questions, I want to make sure I clarify this. Yesterday, when I said saunf, so my wife then clarified later on, it was ajwain. So it's a different kind of a thing. So let me show it to you. So ajwain, they look the same. Ajwain. So ajwain, and I'm going to put this link in here. And my wife said, ajwain is not for everyone because it can cause blood pressure rise in some people. So here is ajwain. That is what she's given me. And that is how I'm just like normal. Ajwain's tea. So I actually asked her to make it in front of me today. So she put some ajwain in a little tea bowl and she boiled it and she gave it to me. So ajwain is also called carom seed or bishop's weed. So Trachispermum emmy is the one, thymol seeds, bishop's weed, or carom. And again, if you see this, it says we do not know if it is effective or not. We have no safety profile for this. We do not know the adverse effects. Women who are pregnant should not take it. Women who are breastfeeding. So meaning there is no allopathic research on it. There are Ayurvedic or herbal researches. Anyways, you can see what happened to me when I started taking it about 2-3 days ago. But I wanted to make sure saunf is very good as well. However, this is ajwain. Okay. Let's go with more questions. So Ashley says, if you had to recommend 3 or 5 of the best supplements along COVID or vaccine injured, what would be your top recommendation? So of course, vitamin D and C are very important. I think that glutamate, I believe, very important as well for reducing mitochondrial injury. Vitamin E is very important. But long COVID, I don't think can be managed with supplements. It's not balancing the immune system. It is really actively stopping these cells from being crazy. And for that, the I recover like protocols are important. If you talk with Dr. Bruce Patterson and group, they swear by Miraviroc and statins, and they say that's our go-to. But at the same time, they have a patent on Miraviroc's use for long COVID. So there is an inherent propensity or leaning towards that as well. Siddhartha says, ajwain is amazing stuff and works terrific as an anti-nausea. Very good to know. Thank you, Siddhartha. So Nipa says both ajwain and saunf are usually taken after meals. Yeah, saunf is actually in many of these Indian Pakistani restaurants as well after the food. Then when you're going out, there is that little thing with those seeds in them. So I saw some questions that scrolled past, so I'll try to go back to them and try to answer if I can. Greenery says, Novavax mechanism probably similar. So Novavax has this spike protein. There is at least mechanically, from a mechanism point of view, there is a difference which is very interesting. Let me show you that difference, which would mean that maybe Novavax may not have the same problem. And that is the following. In case of a messenger RNA type vaccine, the messenger RNA or the lipid nanoparticle with messenger RNA, this whole thing gets into a normal, regular civilian cell, right? And then this cell starts making antigens, and then those are presented on the surface of the pieces of them. And if you break the cell like an egg, then it can release these antigens in the fluids as well. On the other hand, Novavax is actually a bunch of spike proteins put together in the form of a spherical bouquet. This thing does not enter regular civilian cells. It only gets into macrophage-like cells or professional antigen-presenting cells, APCs. The professional antigen-presenting cell, when they present the antigen on their surface, they are not killed for this. It is their job to present an antigen on their surface, and then the helper cells would connect here with them, and then the immune system will become activated. They would also release multiple interleukins and cytokines or chemokines to activate the immune system, but they are professional. This is like if a civilian person, although in the US there is civilian arrest as well, but imagine if there is a civilian person tries to arrest another person, that may not fly very well for that person. But if a cop arrests another person, you don't do much to the cop, you say fine. So these professional antigen presenting cells, these are macrophages, dendritic cells, and B cells. You don't kill them if they are presenting an antigen. But if another cell, a regular cell, is presenting an antigen, you kill it. So because of that, Novavax will not instigate the killing of the cells that contain the antigen. And because of that, the spilling of the antigen in the blood or S1 will be less. Now, can this be possible that Novavax will be picked up by neutrophils, which will pick it up, shred it, and then release the shred? That is possible. So lesser chances, maybe some, but less. Now, how less? There needs to be a study. Flowers in her hair said art is on the menu. It is on the menu, but I wanted to make sure I can answer the questions related to the last video. So Ashley says, I saw something today about a plant-based vaccine under development in Canada, KoolBeens, I think that it's called. Have you read anything about this? Any thoughts? If so, I presented it last week. So if you like, can you please look at the videos? And I believe I did it last week. Meanwhile, in America says, would like to know if you're familiar with it. Is ketotifen stronger than cromolyn sodium as a mast cell stabilizer? It actually really depends upon person to person. So you would have to switch them to figure out which one suits you better. Many of the antihistamine or the mast cell modulator type drugs, they need to be tested. And sometimes a drug is actually working for a few weeks and it works fine, and then it becomes not very useful. And then you have to change it up. So you have to switch it up. So these drugs do that. So I'm just going to go fish for more question. Matthew says, is there any evidence that long COVID and vaccine damage aren't synonymous? So look, if you said that long COVID symptoms and the vaccine injury symptoms, can they be overlapping? Yes. But calling them the same is actually not right, because long COVID means COVID infection and the symptoms afterwards. If we're going to talk about a vaccine is not COVID. So we can't call it long COVID. It is actually so funny that I say it so many times that vaccine injury cannot be called long COVID. But the people who are canceling me, the auditor said Mubin says vaccine can cause long COVID, and that is Mubin is wrong. I have never said it. So when we asked where did I say it, they said whatever. They moved on to the next objection. And so it, long COVID can only be from COVID. Symptoms can be similar. That is true. Meanwhile, in America says, could an MCAS attack result in fatigue days after? Does anyone know? I do not know exactly if it can do that days after. There are some folks here who have MCAS. Look at this question. P. Georgie says, could you smoke ajwain in shisha for the same effect? Love the live chats, King Bean, always informative. No idea, but good question. Smoking ajwain and shisha, wouldn't that actually hurt the throat even more because we are smoking? I think that if we kind of burnt it, maybe it's not that useful. But good question. I loved it. Greenry says Novavax mechanism probably. I think I just could post-vax ongoing tachycardia after meals be a possible sign of persistent immune reaction to food getting through gut barrier? No, so tachycardia can be because of autonomic dysfunction. It can be because of the fluid imbalances, and it can be because of the cardiac damage, or not damage, but irritation. So there can be many, many reasons for tachycardia. So sorry. John says, oh no, Dr. Bean, I bought so much of the other stuff yesterday. So, John, send it to me. So sorry. Yes, the Joanne is different. They look similar, but they're different. Skyfrog says, I fast regularly every night for 8 hours. Thank you, Skyfrog. Meanwhile, in America says, so is it possible that someone with long COVID still has S1 floating around 2 years post-infection? Maybe I'm the some people where it doesn't go away. Possible. So the discussion that Dr. Bruce Patterson's team has done, or the studies that they have done, they say that let me actually show it to you. It's a good question, and I still have that study open. So if I say, isn't this kind of gross that I remember even the words in studies and I can just very quickly search for the word and go there? I shouldn't be so nerdy. So here, if you, in this study, if you look for the word month, look, in the case of PASC, post-acute, I think something, long COVID, they have their own term for it. The persistence of circulating S1 containing non-classical monocytes up to 15 months post-infection. Up to 15 months post-infection. And I'm sure it can be more than that as well. They may just have gone up to 15 months yet. So here is a study that shows that it is possible. Independently of the different possible mechanisms of viral protein internalization discussed above, indicate that certain conditions may exist to maintain this cell population. This is very important. So these cells continue to live on. Monocytes are not supposed to live on like this. They are supposed to either go away, or normally they leave the blood vessels They usually are circulating. Monocytes are like the fish in the blood. And then when they come out of the blood, they become resident. They go into specific tissues, they start living there, and now they're called macrophages. But here we're talking about monocytes that are just becoming immortal and living for a long time. So, good question. So, Anne Bromley says, I've seen serapeptases recommended for long COVID. Would that eat up as protein? Not necessarily. Good question. So, Ashley, I actually had a patient as well from Wisconsin, if I remember him. Why am I so nerdy today? Um, there was a patient from Wisconsin who said that he got ozone therapy. I have that video as well. But I myself am not a big fan of drawing blood out and doing this therapy and then putting it back in. It sounds so risky to me. Sophia says you're gifted. Thank you. P. Georgie says, glad you liked it. Thank you. So, vax damage and long COVID are different, but vaxxed people with COVID, vaccinated people with COVID whom have our symptoms of long COVID can be included by, yeah, they can, they should. So, that there is the political part of it. I mean, look, I was watching Dr. Paul Merrick's interview where he was saying that they're destroying people's careers, and he said they destroyed my career and they're doing this to others. They're just trying to destroy my business. Half of my business or more is already destroyed by one of the complaint where the auditors won, and they totally did not win on the grounds of actual facts. They just won because they said, we are the auditors, we are going to keep objecting till we say all the appeal processes are gone. So it's just a very strange time. So no, so that was not plasmapheresis. They said that they draw the plasma and then they do ozone therapy and then they put it back, something like that. KC says, in someone who had lymph nodes swell all over their body along with anaphylaxis symptoms after first Moderna injection, could the more severe reaction be due to severe allergies and MCAS? So, not knowing exactly what was the pathology, it is, of course, allergies or body's inflammatory response. All lymph nodes responding and swelling means that the antigen was carried to majority of the lymph nodes, or it swam to many of the lymph nodes, and then the immune cell responded aggressively and they all became swollen. And anaphylaxis is a severe allergic reaction. So whoever this is, they have. And so if there is anaphylaxis happening, then of course mast cells are active as well. So Alexander says, oh no, Dr. Bean will be cancelled by people if he says we have fish in our blood. Yes, tomorrow I'm going to get it. This, John Snyder, you're correct. If from the very beginning, instead of sitting down and waiting for the vaccine, and then the only answer for everything would be the vaccine, if we had, and we being our healthcare administrators, leaders, they had opened their eyes, they had become wise, become thoughtful. I was listening to Earl Nightingale. His talks are beautiful. In one of the talks, he says that somebody asked a philosopher, a psychologist, that what's wrong with us? And he responded and he said, what's wrong with us is, or with men, something like that, is that they don't think. And the point was that people just try to be like others. They just try to follow others. They just try to do whatever others are doing. And they are just trying to follow blindly in their life others, and then feel, why are we not distinctive? And his point was, be distinctive, think for yourself. I think it is a very interesting thing that the thinking part was turned off for the majority of the time. So, John, you're correct that if thinking hat was on, there were so many potential possibilities to explore. One could explore them and then say, no, it is a failure. Instead of just simply not even entertaining those thoughts, they were active demonization and resistance, and bad mouthing and destroying people's careers with it. So to me, when that I'm very visual, and I have to imagine and visualize everything. When I visualize our healthcare authorities, it only seems like a small bratty child who is lying on the floor and kicking his legs to say, no, 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 we would only do this, and anything else you say, I'm going to cry. Okay, so Augie. Augie says, any connection with long haulers? Connection, Augie, of what? Matthew says, there were pubs in the UK who continued to trade during lockdowns. They had their alcohol licenses revoked. They continued to trade. Authorities become paper tigers very quickly. Well, I'm sorry to say, but UK's own prime minister was doing whatever he wanted while he was imposing sanctions on others or restrictions on others. So the power, the absolute power corrupts absolutely. So that was happening. It was us to carry the burden of physical uh, distances and masks and the good of the behavior. KC says, so would the S1 possibly be contributing, causing response to be worse? Yes, it is possible. And I would simply say all of these responses, which are worse, are because of the spike and antigen, and S1 is part of that. So Super Alien says, why every time I make a mental stress, I get brain fog? Is it treatable? Please, thank you. So short answer, yes, it is treatable in most cases. I actually recorded this video today for FLCCC that I think they would post next week or week after. I'll record that for us as well, maybe next week. And that is 91% of the people in that study had long COVID even after 35 weeks, but 35 weeks, but their symptoms continue to gradually become less. There were some symptoms that kept becoming more. And I know patients who do not have the symptoms going down, they keep getting intensity. Number one. Number two, but majority symptoms keep going down. And then the mental issues or the symptoms, sorry, I shouldn't say mental issue, the symptoms of the long COVID were relapsing because of exercise, because of stress, and because of mental work. So, yes, treatable as well. I would really request everyone to look at iRecover protocol on FLCCC. Okay, so should we do some cute faces, some drawings and expressions? Okay, let's do it. All right, I'm going to share my screen. You're going to learn art from the person who draws this amazing art, as you see on the screen. Okay, so last time we had done this character drawing where, excuse me. So here is a head and one more head and one more head and one more head. Remember? And we kind of said somewhere here a line, upper part of the second head, then upper part of the third head, and a little in the center. These were the lines, right? And we connected these lines and these. Then we did something like this and connected here, did this. And then we did something like this. And that was, the hands are a little short of genitalia. They should actually cover, meaning our length is usually such. Okay, so although when we have bent our elbows, it is possible for hands to not reach there because bent arms can be like this too. So anyways, we did this, and then if you do this, the eyes here, then half here nose, half here mouth. So we saw how to draw this last time. I want to draw this in a more stylish way, and that will be have a head here, one head, two. This is a squished second head, two, three, four. Then instead of the center like here, make it like this. So it's looking on a side. And then one, let me actually use red lines. So one, do this. This person is looking on a side. Then have a line angled like this and another line angled like this. And normally our shoulders and hip, they are angled not like this. They both are usually not like this. If one is going this way, then the other goes this way. And similarly, if one goes this way, then the other goes this way. Although we are human beings, we can decide whichever way we want to do it, but generally this is what happens. Then same thing here. And now one leg this way and the other leg this way, or one leg this way, that he is putting his, and the other leg slightly like this. Right? So you can see that the person's weight is now shifting on this side. And you connect them like this. And so now you can see as well that he's standing with a little bit of a style, right? And then let's say you do something like this. So he's probably singing, and we'll do the other hand the same as before. So check this out. And we make the ear here. So if I remove the construction lines, you would see that this person looks much more stylish compared to the other one. So look at that. How is this? So this is another way to make the person. We can make it even more fun by maybe making a similar thing. So if I take this picture, bring it here, and then what I do is I will make one of his feet go up in the air, or let's say go up like this, and do some lines here, and then this. Now, and then I laugh at my own cartoons. Look, he is now even more stylish, although it almost looks like he's gonna fall or something. the This part is not looking correct, but oh well. This is another way of making him more stylish. So with this, next thing, some expressions. So I usually keep an expression sheet. Wherever I find good expressions, I catch them and I keep them so I can use them. So I'm going to make some expressions here for us. And more cartoony expression than more portrait-like expressions. So let's do it. So normal, straightforward expression. If you wanted to do a good construction of it, usually what you do is, this is the head. You drop it, you slice it in half, and this would be the eye line. And here is the center. Normally, if this is the eye here, between the two eyes, there is one eye's distance. So one eye, second eye. Then the remaining part down, that would be further divided in half, and that is where the nose will be. Then, excuse me, the remaining part you divide it in half as well, and that is where the mouth will be. So if you wanted to have a more, and the ear goes from the eyes to the nose. So you wanted to have a more appropriate proportions, you could do that. But I usually just, because these are cartoons, you can really do whatever you want with them. So let's start from here. This is one kind of neutral face. Let's make that face a little more kind of meh, kind of a face, that whatever. Right? If you do like this, now is more meh, right? If you do like this, then he's sad. If you do like this, then he's happy. So this is one way to quickly have an emotion. Then look at this. Make the person look this way, and then I'm going to make him look like this. So here is, it looks like a little mustache. So now he's a little unhappy. Then check this out. Here is a person, and then eyes closed, sad face. And then look at this. Do this and do this and this. Check this out. This is a good expression, right? Okay, so then let's say a person is kind of like, come on, stop it, kind of a face that, hey, I'm annoyed, stop annoying me. So that is another face. Then here is a person. I make this very often with the SARS-CoV-2. You do this and this, and that is already an angry face, right? But then you make eyes like this, like little pizzas, right? Slices of pizzas like this. And then you make this on top of them, and you put two lines like this, and you make eyes like this, and all of a sudden this is an angry dude. So if I did the same thing here, do this and this and this, put the eyes here, and then make these, and this is an angry guy. I, for more fun, I put sometimes like this and this. Good. Now a like yikes face, like yikes. Like yikes. Then I love to make this one. I actually had one cell made this one this way. And I had made him like this. I actually made that today as well. And in the previous video, I had actually made him crying. He was standing in front of a T cell, and this was the infected or vaccinated cell, and he was crying because he knew that the T cell was going to kill him. So this is an interesting emotion. Then if you want to make a sad face, you could do this. Look at the eyebrows. Just this eyebrow itself kind of makes him sad. And so then you put these and these. So this is quite a sad face, right? And you can make another little face here who is looking at him and is kind of happy that this guy is sad. So then let's make one more person over here who has, let's say, glasses. And he's looking at this guy. They're not all anchored, they're all flying in the air, but still, right? So then let's make a big smile. So let's say this is the eyes, and here is the big smile. And if you wanted to make teeth, I think I talked about it before as well, just two triangles and maybe a tiny line. That is sufficient to give a very sparkly, beautiful smile. You could even do this as well. That also gives a good, you could even just do this and this. That gives a good smile as well. I laugh at these guys. Okay, so then you could really bend it. So for example, here you could do this and this, and then make these triangle and kind of bend this as well. And if you, for extra measure, you can put this little, the cheek going upwards. You could do this under the face everywhere, and that is kind of the chin. And so on. So these are some expressions you can make And these are a few characters you can make. Has all the cool beans left. Pocomo says, potato couch monkey. More doctors need to learn to draw as well as you, then explain their diagnosis to patients in cartoon form instead of the language none of us understand. So, actually, a funny story. When I became a doctor, I had recently graduated. I did my house job, which is like in residency. And then I was looking for medical jobs. And one of my friends said that he was doing a free clinic in a village near the town where we were living. And he said, I want to stop working there, so maybe you can take it up. So I said, okay. He said, this is good experience. There are only 3, 4 people who come in every day. So you can go there, not much work, just 3, 4 people, patients. I said, okay. So I went there. And what I did was I brought a tiny whiteboard and markers. And it was actually a free clinic. And the clinic was actually an open clinic. So what would happen is there is, let's say, doctor's table. And so the doctor sits down here. Let's say this is the doctor. This is the doctor. With doctor like these, who needs help? Okay. So here is the doctor. And then the patients would come and sit down here. And they would just be, uh, meaning they're supposed to be 2, 3 patients who would come here, and there would be 2, 3 chairs. And then one of them would come here, sit down in front of you and say the problem and blah. And so that was the clinic practice. What I did was I brought a little whiteboard with me that I would put next to me before we'll do anything. And when the patient would sit down and they would have their problem, I would go on here and I'll say, well, you have this esophageal reflux, and that is what happens. And when you eat something, meaning I would explain it. When I'll explain it with this, guess what happened? Number one, within a few days, we used to have 300 patients sitting here. I could be there the whole day and not be done because there'll be 300 patients there. And secondly, patients actually started taking care of themselves because I would explain what is the problem and then explain why this is occurring. For example, if they're not eating correctly or if they're eating things that are causing it. And the patients would now come to me and say, you know what, you told me that not to do this, and here is the explanation. So I'm not doing it and I'm feeling much better. So that was very, very interesting, that how patients became owners of their own health and they could think about it by themselves. And then they were taking care of them, and then they would go home and they'll tell others, and then more people would come in. And their reason of coming in was not to come in and say, give me medicines. They wanted to understand what's happening with them so they can then think about it. So that was a lot of fun. That is true. So now I'm doing the same drawings on YouTube. Critical thought says that is doctoring. Yes. So that, although I'm cracking up at the doctor, this was the doctor, this was me. I should give myself a little blue chair and maybe a little gray table. And the patient, let's make the patient in blue. This is it. So that was the doctoring that was happening. I should at least make this person a little better in their posture. So how about that? Yay. So blue, blue team. And there are more blue teams here. So this is what was happening. Thank you. Meanwhile, in America, DrBeen says, I'm a kinesthetic learner. My recall works in images, so I'm able to relay what I learn here with others by seeing your drawings. I am the same way. I have to imagine and picture things, and only then I can attach emotions or thinking to it. Just like I was talking about the healthcare administration, I literally, in my head, visualize them as little bratty children lying on the floor, kicking their legs, saying, vaccine, vaccine, vaccine. Casey says, need more educating patients for preventing, so need less medication for disease. Thank you for that. Is correct. I believe that once a person understands the problem or the mechanism, they can think for themselves. And you don't have to keep asking, do this, why did you not do that? Once they understand it, then it's their choice. If they don't want to do it, don't do it. But understanding the problem allows them to own it and work with it. John says, are you sure this is not a department of motor vehicle officers? It seems like that. But there is this little stomach here. So, Patty Bond 007 says, any idea if the thyroid gland might be the cause of long COVID fatigue? So, long COVID fatigue is hypothyroidism, may be one, and that is just because hormonal changes can occur. Number one. Number two, it is also possible that their fatigue is a couple of ways. One is where neuromuscular junctions are not working correctly, and so the muscles are not working right. Or the other one is that their brain system is inflamed, or there are inflammatory molecules crossing in there, and that is causing less uh, activity through the brain. And then there can be other nutritional aspects as well. For example, liver not working good enough or thyroid not working good enough. Thank you, Grace. Now that image will recur every time I see a leaders on TV. Only healthcare leaders. John says line would be longer at the DMV. Correct. And there may be more than one windows as well. Skyfrog says, our disclaimer for Dr. Bean. I know you believe you understand what I think I said, but I'm not sure you realize what I said is not what I meant. Thank you for the disclaimer. That is funny. Meeple Art says, enjoying your art lessons and having fun sketching away. Meeple Art, you yourself are an artist. You should do the these sketches and teaching. You can see how bad of an artist I am. I am spoiling people. Susan says, fun Friday night ice cream and drawing. Very nice. More windows, but only 1% at all, 20 windows. Yes. JR says, is Dr. Bean sick? No, not sick. I have this lingering cough, which is very much in control. A few days ago, it was really bad. But now sometimes I develop it. And by the way, my wife managed it. And so she was saying to me today, she said, tell the KoolBeens that here I do the doctoring for you. I said, yes, you are very correct. Meeple Art says, can you teach cartooning of actual people, like a portrait that looks a bit more, mm, bit like someone, perhaps yourself? I think I can, because I understand the planes of the face, and so I know how to structure the face, but I've never tried it. So maybe I will try it. P. Georgia says, I'm still not allowed to give blood here in Australia due to mad cow disease presence in UK as a kid. Do you think something similar may occur between vax and non-vaccination in the years to come? I think there would be, in the short run, there are possibilities of saying that vaccinated should not. And then if these exosomes or the spike proteins or S1s or higher levels of uh, inflammatory markers are found continuously, then they may not be allowed to do it because their blood would cause others to have inflammatory responses too. Denise says, I think it's also the new microphone changes your voice to sound a bit off. That is true. So I have to, what happened was the microphone lost its configuration. So I have to reconfigure it. Yes, Dr. Queen Bean. That's true. Skyfrog says, I would like to see a caricature of Elquin. So one day Elquin had said that we should draw a turtle, and I forgot to. So I have never drawn a turtle. So I'm going to draw something which I think is a turtle. So if it is not, then my apologies. So let's say this is the turtle's neck, and this is the shell's opening. I've never made it, so okay. So then let's say this is a shell. like like a car. So then what I do not know is how does the turtle's claw look like? So sorry, too far. I just made Luffy's claws here. And so if I now make these, should we make a tiny tail? Then we can go in here and color this turtle. This is Alcuin's turtle. So what we should do is we should take this here, and those areas that are underneath, kind of make them a little darker lines so they look like they are on the floor. So is a turtle's shell touching the floor as well, or not? Sorry, I'm trying to make his other leg on the other side. So this will be, so somewhere over here will be the other leg, like this. So maybe we'll just color it this way. There you go. Do turtles have these little antennas as well? That would be a nice turtle with an antenna. So there you go. There you go. We have a turtle. Alien turtle. Okay, so I have to now take this and take this challenge and see turtle sketch. Okay, so how does a turtle? Well, I was almost there. I just did not make the I did not make anything correctly. But this is a kind of a laid back turtle who was he was just chilling. Okay, I should not make antennas to give him a little more authentic color, authentic feeling. And it looks like, if you see here, the face has this little beak like thing to it. And the eyes are like big eyes like this. And the face has this structure. It looks like he has a mustache. Okay. So I think this is fine. Better now. Okay, this is it. This is the turtle. I am sticking with it. This is my turtle, and I approve this message. Okay, there you go. Guy Telfer says, is the spike found in bloodstream from COVID-2, vax, or both? So we know that spike can be found in COVID, and that S1 protein studies were mainly for COVID from Dr. Bruce Patterson. I may have missed that in the last lecture. So that one was vaccine, Moderna vaccine. Are there differences between intravenous injection on the arteriole side and on the venous? Yes. So the arteries, when you are giving injection in them, the injection would go further down, and vein would bring injection towards the heart and then circulate. So plus the arteries take the blood or the molecules directly to the tissue. Vein can actually bring it to the liver where it can get processed and activated or deactivated, and then it can circulate. Headed has Dad Jim says it depends on the type of turtle. It looks like you're going more tortoise. Good. So something I should actually do one more thing now that you're saying it. Um, there should be some darkening here to kind of prove that this is a right. Something like this. The legs are coming out of those holes. Denise says, Yertle the turtle. Well, Denise, your little emoticon turtle is nice. John Snyder says, tortoises are brown with longer necks. Okay. So this is a cartoony thing. Something. I can actually make it nice for you if I did this. How about now? I think it's perfect now. There is a rider as well. We should make one more little. He's holding on to the turtle. He's trying to climb on it, but turtle is moving so fast. How about now? Oh, I should make one more one that is kind of holding on to the turtle because he also wants to get on it. So he's saying, give me a ride as well. There you go. Sorry to the artists. Uber Turtle, yes. Turtle Taxi or Uber Turtle, yes. So let's call him Uber. I hope Uber people do not sue us. Should the turtle have like a Uber sign here? And another sign. This is the best turtle ever. Yes, has dead Jim. Yeah, correct. He's going so fast that the other guy is not able to get on. I should make some dynamic lines as well. Like And turtle is kind of rushing. So the whole thing is it it is so paradoxical, but sure. So the world is moving fast here in this little world. Cool. Yes, yes. There is a Lyft and an Uber. Meanwhile, in America says tuber. Yes, tuber. Johnson says, if the turtle takes you to the dragon palace, do hundreds of years pass? I think so. Matthew says, that turtle's fast. Absolutely. He's going really fast. Especially his gesture on the neck is showing how fast he's going. Margaret says, should the turtle be smiling? Well, let's make him smiling. It's our turtle. We can do whatever we want with him. Like Bob Ross. So here is the turtle. Quite a smiley turtle. There you go. Make a tiny bit of this. And little. There you go. We have a smiley turtle now. Critical thoughts. Better. Which is biologically impossible. Yes. So Juby says, you're killing now. I love to laugh. Thank you. Well, that is the point. Um, just some education together and some fun together. So with this, let us break for tonight with this turtle at your service, and it would take you back towards good night's sleep. And please like, subscribe, and share. And share the last video. That is actually a better one. And like, subscribe, and share. Do you know that on this channel, since I became the YouTube partner, I earned $14 of ad revenue. So that is awesome. So I would see you on Monday. Have a nice weekend. Like, subscribe, and share. In the description, there are links if you would like to buy DrBeen premium account or would like to support this work. Thank you very much. I would see you on Monday. Bye-bye.